So my name is Dr. Claire Gillan and I run a research lab at Trinity College in Dublin. And what our goal is to try and understand the basic mechanisms that give rise to disorders of mental health and to try and use this information to improve how we define, diagnose and ultimately treat mental illness. And in particular, this last piece of the puzzle, this issue of treatment allocation, has become a key focus of the work that we do in our lab. And what we're really trying to do is test if all of these wonderful basic research studies that we do can survive the test of clinical translation, can help us get the right treatment to the right patient first time around. So our approach to kind of all of these different questions about definitions of mental health and their treatment center on the idea that every patient is an individual, right? That we can't neatly assign patients to discrete categories and expect that they're going to all behave in the same way depending on what categorical disorder they get assigned. And there's lots of evidence to suggest this might be the case, including, for example, the fact that patients present with multiple disorders at once. So what we try and do what we mean by this individuality of patients is that we try and appreciate and measure the vast individual differences across patients who might have the same diagnosis in terms of their early life events, their current life stressors, their current lifestyle, let's say their exercise, their diet, their way of thinking and approaching the world, their history of experience with treatments and their expectations about future treatments, but also key biological variables like their genetic risk if they have mental illness in their family, their cognitive and pharmacological profiles, as well as differences in the structure of their brain and its function. So we think all of these things are of interest and of grave importance in our understanding of really how we know our understanding of which treatment to allocate to which individual. But we also appreciate that question is really complex and that one-to-one relationships are incredibly unlikely. So our answer is to try and use tools from data science that can harness all of that wonderful complexity I just described to try and make predictions that we're basically not clever enough to make ourselves as researchers. So to do this, it requires kind of a mammoth effort. So the current study that we have going on at the moment, which aims to predict treatment response on an individual basis, is following 1,000 people through a course of either cognitive behavioral therapy or antidepressant medication. And for each patient in our study, they complete a comprehensive baseline assessment that includes lots of the measures I described before. What's perhaps most unique about this study is that because we have to catch patients within a couple of days of starting one of their treatments, we realize it's impractical to do that in a face-to-face capacity. So instead, we're actually recruiting subjects from all over the world and they participate entirely remotely. So they provide a vast quantity of self-report information as well as performing tests that tell us things about how their brain works and providing information about their family history, etc. To date, we've had participants from Ireland, of course, the UK, Australia, New Zealand, Canada, and of course many from the United States, and more coming through each week. If you want to find out more about this study and our general approach using machine learning techniques, I suggest you go visit www.antidepressantresearch.com to find out more information, and hopefully before too long I'll be at the ABCT to tell you about some of the results of this study.